Hello students, Inspector Catchit here today. I know you were expecting Menopause Taylor, but I'm filling in for her today. This uniform is a requirement of my job, and my job is an inspector. These are the gloves I'm supposed to wear, but they sure are boring. They don't even match the rest of this uniform. I think it would be better if I wore these or these. Anything would be better than these old brown things. But let me get back to the topic at hand. Like I said, I'm Inspector Catchit. Breast cancer, that is. And my job is to teach you about catching it early. And that's why I'm Inspector Catchit rather than my normal identity as Inspector Gadget. Unfortunately, I won't have to wear these awful gloves today anyway because they are not indicated for breast inspections. This is video number 390, the 35th video in our big unit on breast cancer. So far, you've learned all about your breasts in general, benign breast diseases, the risks for breast cancer, and the pathology of breast cancer. In last week's video, you discovered that there are no early warning symptoms of breast cancer. The symptoms don't present until the breast cancer has been present for a long time. It's most commonly stage 3 when symptoms appear, and occasionally it's stage 2. But that's a big problem because then it's more difficult to treat and cure. Well, if the symptoms of breast cancer present late in the course of the disease, you need to know how you can catch it early in the course of the disease, and that's where I come in. Today, I'll teach you about breast inspection. Inspection is my specialty. I'm Inspector Catchit early. This material is in chapter 30 of both books, first edition and second edition, and I think it's a very important part of that chapter. But you're going to get even more out of this video. So let me start by explaining what I mean by the term breast inspection. Breast inspection is any means of detecting breast cancer early before symptoms develop. And there are two separate means by which you can find breast cancer early. You can feel it with hands, or you can see it with mammograms. So these three things go hand in hand, ma'am. Hand in hand, ma'am. Get it? Human hands and mammograms. All told, the 3 prongs of breast inspection are self-breast exam, clinical breast exam, and radiologic breast exam. I often refer to them as SBE, CBE, and RBE. You know, as an inspector, I quiz people a lot. It's my way of conducting surveillance on what they know. So how about a little surveillance on what you know about breast inspection? Which of the following is true with regard to breast inspection to detect breast cancer early? A. Current guidelines do not recommend that women perform self-breast exams because they claim that women are incapable of doing so. B. Current guidelines recommend that all women perform self-breast exams. C. Women resist recommendations to perform self-breast exam. D. A doctor performing clinical clinical breast exams is likely to detect breast cancer earlier than a woman performing self-breast exams. E. A woman performing self-breast exams is likely to detect breast cancer earlier than a doctor performing clinical breast exams. F. Mammograms cause breast cancer. G. Mammograms can detect breast cancers that are not palpable by breast exam. H. A, C, E, and G above. I, B, and D above. J, B, D, and F above. K, B, C, and E above. Well, what do you know? Tell the inspector your answer. Which options are most logical for catching it early? Breast cancer, that is. Well, it might just surprise you to see the answer. So this means that current guidelines do not recommend that women perform self-breast exams because they claim that women are incapable of doing so. And women resist recommendations to perform self-breast exams. But a woman performing self-breast exams is likely to detect breast cancer earlier than a doctor performing clinical breast exams. And mammograms can detect breast cancers that are not palpable by breast exam. Are you surprised? Well, let's dig into this a bit. The most basic thing to get out of this video is the fact that breast cancer is a very curable disease if you catch it early. In fact, the survival rates for breast cancer are some of the highest for any cancer. So catching it early is truly life-saving. And since symptoms don't present themselves until late in the course of the disease, breast inspection is the means by which you catch it early. And an early catch means cure. So this breast inspection business is ultra important. There are two means of detecting a breast cancer early. You can feel it with hands, or you can see it on radiologic exam like mammogram. So, these things go hand in hand, ma'am. There are some breast cancers that you can feel before you can see. And there are others that you can see before you can feel them. So, you never know which it's going to be, do you? So feeling and seeing are complementary. And there are two means of feeling breast cancer and many means of seeing breast cancer. So that gives us our three categories of breast inspection. Self-breast exam by you, clinical breast exam by your doctor, and radiologic breast exam by a radiologist. We will address all of these superficially in this video and then address each one deeply in the upcoming videos. We'll start with the two means of feeling a breast cancer early. They are self-breast exam by you and clinical breast exam by your doctor. Self-breast exam entails doing your own breast exam on a regular basis. The goal of self-breast exam is for you to become the world's greatest expert on your own breasts. In other words, your job is to know your own breasts better than anyone else knows them. I mean, face it, you should know yourself better than anyone else does. And the same goes for your breasts. You should know your breasts better than anyone else does. You should know how they normally feel to your hands. Here's an analogy. Imagine forming a great big circle of people, including yourself. And let's say that every person in the circle extends his or her arm into the circle to display the back of their hand. If someone took a photo of nothing but the hands in the center of the circle, would you be able to identify your own hand? Of course you would. You know the back of your hand like the back of your hand. You are familiar with the back of your hand. And would you be able to identify your own hand better than any of the other people in the circle? Of course you would. Nobody knows the back of your hand better than you do. Why? Because your hand is with you all the time. You see the back of your hand daily, all day long. Your familiarity with it exceeds that of anybody else's. And the same would be true of your foot or just about any other part of your body. You see, familiar expressions always have some truth to them. There's a reason that particular familiar expression about knowing something like the back of your hand is all about self-familiarity. I'll bet you could pick your breasts out of a lineup too, couldn't you? So your breast exam only requires you to know what's normal for your own breasts. And if you know what's normal, you will be very good at detecting anything that's abnormal. This is why you have to do your self-breast exam yourself. Not your male partner, not your female partner. As much as your partner may know and love your breasts, he or she cannot know them as well as you do. So that brings us to two of the quiz answer options that are shocking. The first is the fact that current guidelines do not recommend that women perform self-breast exams because they claim that women are incapable of doing so. Can you believe that? Isn't that the most ridiculous thing you've ever heard? How dare the guidelines or anything else doubt your ability to be familiar enough with your breast to catch breast cancer early? This kind of thing just burns me up, as they say. I hate it when anything in the medical industry tries to take your power away. You are fully capable of doing your self-breast exam and doing a very good job at it. Your only limitation would be amputated hands. And in the next video, I'll teach you the how, when, and what of self-breast exam. In other words, I'll teach you everything you need to know in order to do a mighty fine job at self-breast exam. The second shocking quiz answer is the fact that women resist recommendations to perform their own self-breast exams. I've encountered this way too often. Most commonly, when I ask a woman if she does her self-breast exams, she will say, "No, I don't because I don't want to know." What? Are you nuts? What do you mean you don't want to know? We're talking about a curable disease, not a terminal disease. But it's only curable if you catch it early. And the best way to catch it early is by doing your self-breast exam. This resistance to self-breast exam is based entirely on fear. But you should fear the things over which you have no control, not something over which you have lots of control as long as you catch it early. Do not choose to remain ignorant and unaware. Choose to be proactive, engage in your health, and know your breasts better than anyone else does. Use your own hands to do your own self-breast exam. And that brings us to the second means of feeling breast cancer early, a clinical breast exam by your doctor. Clinical breast exam entails having your doctor do a breast exam on your breasts during your annual checkups. And once again, you might have been shocked to discover that one of the correct answers to the quiz question was that a woman performing self-breast exams is likely to detect breast cancer earlier than a doctor performing clinical breast exams. If you were surprised by this, you probably thought that because a doctor checks breasts all day, every day, he or she would be better than you are at detecting breast cancer. But you were overlooking the most important thing of all: familiarity. Just a few minutes ago, I told you that the goal of your self-breast exam is for you to be the world's greatest expert on your breasts. Your job is to know your breasts better than anybody else does. And the better you know your breasts, the earlier you'll catch breast cancer. Yet, most women think their doctor can catch breast cancer earlier than they can themselves. This is definitely not the case. Tell me this. If you check your breasts every month with your own hands, and you never check any breasts other than your own, and your doctor checks dozens of breasts every day, but only checks yours once a year, which of you is more likely to catch a breast cancer in your breast the earliest? Hands down, you are. Not only will you be checking your breasts more often, you will also be checking only your breasts. So there's no way you won't be more familiar with what's normal for your breasts than your doctor. Your doctor should still do a clinical breast exam every year at your annual checkup, but it is in no way superior to your self-breast exams. And it is definitely not a substitute for your self-breast exams. So when it comes to feeling your breasts as a means of inspection, both your self-breast exam and your clinical breast exam are critical to catching breast cancer early. They go hand in hand. Now, other than feeling your breasts as a means of inspection, there's seeing. And all the means of seeing a breast cancer early involve some kind of imaging with a radiologic procedure. Radiologic breast exam, or RBE, is any radiologic procedure that can see breast cancer before it is large enough for you or your doctor to feel. So today I'll just present these different radiologic procedures very briefly, and they are all called imaging studies or radiologic breast exams. In a later video, I'll compare and contrast the whole collection of them in much greater detail. The goal with all imaging studies of your breast is to see breast cancer when it is too small for you or your doctor to feel. And the smaller it is when you catch it, the more curable it is when you treat it. This is all about visual detection. There are 6 different radiologic breast exams for early detection of breast cancer. 2D mammogram, 3D mammogram or tomosynthesis, contrast enhanced digital mammogram, breast ultrasound, breast MRI, which is magnetic resonance imaging, and breast thermography. All I'll do today is define them. In a later video, you'll learn a lot more about the pros and cons of each. You know that there will be pros and cons of each, don't you? Trade-offs. Everything is all about trade-offs. So first we have the 2D mammogram. A 2D mammogram is the gold standard for finding breast cancer early. It can see breast masses and calcifications that could be breast cancer. The second is a 3D mammogram. It is also called breast tomosynthesis. It's a mammogram that is a three-dimensional view of your breasts, and it takes images of your breasts from multiple angles. Third, we have a contrast-enhanced digital mammogram. And this is a digital mammogram with injection of a dye that is absorbed by cancer cells. Fourth, a breast ultrasound is a means of looking at your breast tissue using sound waves in order to see fluid masses better than solid masses. Fifth, a breast MRI is use of radio waves and a magnet in order to assess the soft tissues of your breast. And sixth, breast thermography is the use of infrared light to detect extra blood vessels and inflammation that may accompany breast cancer rather than detecting breast cancer itself. All these radiologic breast exams are used to see what you cannot feel. They tend to catch breast cancer even earlier than self-breast exam or clinical breast exam. But that's really dependent on the kind of cancer it is. Because you can see some breast cancers before you can feel them, and you can feel some breast cancers before you can see them. But no matter how you approach it, these three things, self-breast exam, clinical breast exam, and radiologic breast exam, go hand in hand, ma'am, hand in hand. I like to think about all of these breast inspection techniques as adhering to the 70-30 rule of breast cancer diagnosis. 70% of breast cancers are detected by a radiologic breast exam, most commonly mammogram. 30% are detected by self-breast exam or clinical breast exam. So don't just count on one or the other. Understand that they are all important. All three go hand in hand, man. And don't complain about the shortcomings of mammograms or other imaging studies if you are falling short in checking your own breast with your self-breast exam. Breast inspection is a community affair, and the community includes you, your doctor, and the radiologist. Each of you must do your part to conduct a thorough inspection of your breasts. The most important thing for you to understand is that all these forms of breast inspection serve the purpose of catching breast cancer early. So here's the summary for today. Breast inspection serves the purpose of detecting breast cancer earlier than the late stages when symptoms present. They include self-breast exam by you, clinical breast exam by your doctor, and radiologic breast exam by the radiologist. All of these work together to feel and see breast cancer early. And early detection of breast cancer most commonly results in cure of breast cancer. So this video was your introduction to breast inspection. And I will give you separate videos for each of these three breast inspection methods over the next few weeks. That's the way you'll need to understand it so that you do each one properly and understand its specific purpose. So that's it for my breast inspection job today. So this is Inspector Catchit signing off. It's time for me to go inspect something else. And now I guess I'll have to comply with the dress code and wear these ugly, mismatched gloves for the next job. So be sure to come back next week. There you'll learn the how, when, and what of self-breast exam. And please go to menopausetailor.me to schedule a consultation. It will enable me to inspect your personal situation and tailor everything specifically to you. Please subscribe here to both this channel and my newsletters, and please follow me on Facebook, Instagram, Pinterest, and Stories. You never know what I'll show you there. Bye for now.